My name is Peter Noordsij. I'm one of the sports medicine physicians here at Concord Orthopaedics. College training in the University of Vermont, and then my medical school training was done at St. Louis University in St. Louis, obviously, and then went to Dartmouth for my orthopedic residency and out to Wisconsin for my sports medicine fellowship. You know, both my parents were doctors, and so I kind of was exposed to, medicine at a pretty young age. And I had a lot of injuries as a kid playing sports, and so I was exposed to orthopedics, kind of through that. And, I think over time I just realized that when I looked at different specialties, that I kind of looked up to those guys when I was growing up, and I thought that if I ever went into medicine, that sports medicine and orthopedics would be something that would interest me. So I've been at Concord Orthopaedics since 2000. I actually came to Concord in 1995, and I think what attracted me to the practice was just the subspecialty nature of it, the ability for me to focus on just sports medicine, which is something that I had sort of specialized in after my orthopedic training. In sports medicine, we take care of sort of multiple joints and just multiple ages of patients. So I think any physician, any sort of occupation where you do different things on different days and see different types of folks, I think that's appealing to, all of us that are in sports medicine. I think it's really important in the doctor-patient relationship for the patient to have trust in what the doctor is sort of recommending. I think that there are a lot of very smart and very astute physicians who don't develop a fair amount of trust with their patients, and sometimes that breaks things down in terms of that. And my experience has been that people need to have that underlying kind of trust that you're looking out for their best interest, and also that obviously you need to have the right answers and you have to have the right education and the right training, but fundamentally I think that patients really need to trust that what you're doing is in the best interest of their getting better. The most rewarding part of the job for me is just I think the opportunity to make people better. I think it's sort of a kind of a generic answer to the question, but it really is rewarding to take somebody who's injured or somebody who is not well for arthritic reasons and really make them more mobile, or make them able to do things that they couldn't do prior to their injury or to the onset of their illness. Staying up to date is a challenge because I think things change so quickly. I think that you asked earlier about what's so enjoyable about the field. I think that's one of the things that is enjoyable, is the ability to sort of try new things, learn new things, and I think right now it's easier than it was when I first started my training in some ways, just because of electronic and digital media and the ability to really attend courses remotely. And so we're required through our licensing and through our own sort of self-policing to have a certain amount of continuing medical education credits per year, and so we do that by going to meetings. There's a learning center in Chicago that we use through the academy, and there are a lot of online sort of resources for us. I don't feel like I'm away from the office very much, but when I am, I enjoy being up at the property up on Winnipesaukee. I'm very interested in. I enjoy wake surfing with my boys. I have two college-age boys, and I follow them around, watch them play sports, and I enjoy playing golf and skiing in the wintertime.